Hello everyone, I am Sanjana, onconutritionist from ZenOnco.io. So today we shall be speaking about nutritional assessment for the cancer patients. So what are the goals of a comprehensive nutritional assessment? The first of all is before your treatment begins, it is very important that we optimize the tolerance for the cancer therapy. Now, as we know, when the patients undergo various cancer treatments, whether it is a chemotherapy, radiation, or a surgery, the prior nutritional status will also have an impact on the clinical outcome as well. It is seen that if the patient is having a poor nutritional status or if they are malnourished, then there can be a poor nutritional outcome due to which they are at a high risk of infection, their immunity is reduced, and their also quality of life is impacted. So it is very important to assess the nutritional status of a patient before the treatment begins so that they're able to smoothly tolerate the cancer therapy, and also the side effects or the symptoms are also reduced. During treatment, it is very important to prevent nutritional related complications. Now, generally, patients will, when they undergo especially a chemoradiative therapy, they often experience several side effects because of the medications or the treatment itself. It could be nausea or vomiting or loss of appetite, diarrhea, constipation, even loss of taste changes. Now, all of these side effects or the symptoms can also have a negative impact on their nutritional status. During this time, it is extremely important that we help them manage the side effects or the symptoms so that it will also help them gradually to improve their overall health and well-being as well. Next is post treatment to provide nutritional rehabilitation. Now this plays an important comes into picture and is very important, especially for the patients who have cancer but they are now in the remission phase. Remission phase is extremely important because during this time the doctor will also give a window period of up to 5 years, so that there are in certain individuals or patients there can be chances of recurrence as well. So a cancer preventive diet is also very important. Now, first aspect of nutritional assessment is the nutritional screening. Nutritional screening will start the nutritional assessment process, and it will also help us identify the patients who are at a risk of malnutrition. Nutritional screening programs need to be designed to rapidly and accurately examine the individuals and also to identify those patients who might require comprehensive nutritional assessment and also nutritional intervention as well. Commonly used nutritional parameters are your height, weight changes, and the change in the ability to eat. First, it is very important to gather data of the patient so that it will give you an understanding of what is the patient's medical history, what is their dietary pattern like, and also we need to take a detailed dietary assessment as well. First, importantly, it is important to take into consideration their medical history and their social history as well. So, this will include what is their diagnosis, are they having any past medical history like sugar, BP, or any other comorbidity which we need to take into consideration. We also need to understand what medications have they been taking as well. Next, we also need to understand what is their dietary assessment. So, in dietary assessment, we need to get a detailed understanding whether the patient is having any nausea, vomiting, or have they been experiencing any gastric discomfort like constipation or acidity, bloating issues, or have they been experiencing diarrhea as well. Also, it is important to understand if they are experiencing any taste changes or loss of ability to taste, which could also reduce their food intake also. Are they having any food allergies or a food intolerance towards any food is also important before we plan a diet for them. Next is the anthropometric measurements. Now, in anthropometric measurements, not only body mass index, which is BMI, is important, rather, it is also important to take into consideration their height, weight, and also the recent weight changes as well. And we can also understand what their ideal body weight has to be. We can also check for their hand grip strength to understand what is their grip strength as well. To this will also help us to understand as to what is their muscle mass percentage. Move ahead to the biochemical parameters. So in biochemical parameters, it is important to uh, assess the biochemical parameters such as complete blood count. In this, we need to know the hemoglobin levels, the platelets, the absolute neutrophil count as well. Next, we also need to understand the other parameters like albumin or pre-albumin, yes, electrolytes, uric acid, and also other parameters like the renal function test, lipid profile, and the liver function test is also very important to be assessed. So to conclude, yes, nutritional assessment is very important not only during treatment but also before going into a treatment as well and after treatment. This will help us to understand what is the nutritional status of the patient. It will give us a better understanding how to monitor the patient closely and also how to do the dietary intervention as well. Thank you so much for watching this video. We at ZenOnco are always by your side, offering the support and the guidance as you navigate through your cancer journey. For help regarding cancer, you can surely reach out to our cancer coaches on the below mentioned contact number.